All right, so I am here with Julie today, who is very stunning, but she was really starting to feel the effects of aging. She has very moderate volume loss in her cheeks. She's early stages of jowling and has some folds around her mouth. On this side, let me turn. I already did place some threads using my technique on her right side of the face. And the left side of the face, I made what's called introducer points. Introducer points are the areas that I numb prior to treating, and I make small little punctures that allow me to actually put in the thread. So what I'm going to need to do is anchor these threads into place and then cut them off. For this particular procedure, I actually refer to it as purse stringing because, as you'll see in a second, I'm actually I'm sort of hugging the skin upwards. I'm manipulating that fat pad in an upward motion in a movement that looks like I'm tying a purse string.
That really looked so like instant. I mean,
yeah.
You know, I would say in general that we that do facial rejuvenation were sort of a little negative on threads initially, but everything about the procedure has improved dramatically. The quality of the material, we know that it does last longer than they originally said, and we're not really seeing many problems with infections, problems with the threads themselves.
These threads have little hooks on them. They're kind of, think of them like little teeth, and the hooks are what allow us to lift up the tissue, okay? And what will happen is collagen will form around those hooks that will allow them to integrate very nicely in the tissue.
The suture has barbs on it, and when you pull that up and put it in place, because the barbs open up, it can't fall. That's what keeps it secure and in place. Pretty
That's
cool.
Correct.
I have another question too. Now, she's been saying the word collagen a lot. Is that because as we get older, the collagen, we lose a lot of it, and this helps to regenerate it?
Oh, absolutely. So the PDO substance itself will actually form collagen 360 degrees around the axis of the thread. So even once the thread is fully degraded, which takes several months, even once that thread is gone, the collagen your body naturally produced in place of that thread is still going to be there and continue growing for many months beyond. So the thread may only be in your face for about 6 months, but the effects of the thread lift are actually much longer than that.
Oh, that was another question. How often do you do it? How long does it last?
So, everyone's a little bit different. I generally say about a best case scenario, approximately about a year.
Nice.
Wow.
Are you ready to see?
I'm ready.
All right, you guys. Can I show her the mirror?
Well, we can see it
for
sure, and it was cool. It was cool seeing the first side and then the second side. They now match up, and pretty darn quick. And so,
look at her face. Look at that smile you just gave her.
This is the best part of threads, is handing the patient the mirror, because the reaction in such a quick in-office procedure is unlike anything I've seen with any other minimally invasive procedure.
So in your mind, Dina, who is the right patient to do this on?
So the ideal patient for this procedure is someone that's really just sort of starting to feel that they're seeing the signs of aging. 30s, 40s, 50s, they're great patients in most cases. It's not surgery. So patients just have to understand what the outcome and what the likely outcome is going to be. I have patients that are in their 20s that are coming in that want a bit of a cheek pop and to sort of pull back and contour their jawline. They call it snatching, I guess, these days.
Yes.
But, yeah, girl. But
I knew that she knew that the sister knew about the snatchism. Okay.
Yeah, right. But in those cases, we would have historically used filler in the cheeks and in the jawline. But now I use threads. Why? Because it's going to be a longer lasting procedure. So the results are going to be longer. The results are going to be better, and we're getting a happier patient out of it.
Listen, Julie, great result. You should be thrilled. And Dina, thank you for your expertise. That was very cool.